Hello, my name is Vanessa Burkoski, and I am the immediate past president of the Registered Nurses Association of Ontario. On May 9th, the first day of Nursing Week 2016, our association released a landmark report at the Queen's Park press conference, Mind the Safety Gap in Health System Transformation, Reclaiming the Role of the Registered Nurse. Ask any nurse today and they'll tell you that their patients have more complex needs than ever before. Yet despite clear indications that care complexity is increasing, registered nurses are being replaced by less qualified nursing personnel. Health Human Resources analysis show that the growth of registered nurse employment is barely keeping pace with population growth, and at times falling below. Furthermore, at a time when care complexity is increasing across all sectors, the ratio of registered nurses to registered practical nurses is sharply decreasing. Indeed, data shows that between 2005 and 2010, the ratio of registered nurses to registered practical nurses was 3:1. By 2015, the ratio dropped to 2.28 to 1. In hospitals, registered practical nurse employment growth rates have more than doubled the growth rates of registered nurse employment. Let me be very clear. Registered nurses, registered practical nurses, and nurse practitioners all have critically important roles to play in the health system. However, in the government's Patient First plan, Ontario hospitals are being positioned to care for the sickest of the sick, those with highly complex needs and instability. Therefore, it makes no sense that at a time when acuity is planned to increase in hospitals and in the community sector, RNs are being replaced by less qualified personnel. Extensive research, including material from the College of Nurses of Ontario, recognizes that caring for highly complex patients is part of the registered nurse's role. This is why RNAO is calling on the Minister of Health and Long-Term Care to legislate an all-registered nurse working force in acute care to be effective within 2 years for tertiary, quaternary, and cancer centers. By design, these facilities are meant for highly complex and unstable patients. Most patients that are stable with predictable outcomes would be better off and less at risk of iatrogenesis by being supported with care in the comfort of their own homes. Within 5 years, we are calling for a legislated all-registered nurse workforce in large community hospitals with more than 100 beds. These hospitals deliver a high degree of specialty care and are often referral centers for smaller community hospitals. They are managing unprecedented levels of acuity and complexity, which require the expertise of registered nurses. This also means nurse practitioners and clinical nurse specialists will have crucial roles in both direct care and supportive care. To that end, RNAO's report includes specific recommendations aimed at tearing down all barriers that handcuff nurse practitioners to fully serve Ontarians. Minding the safety gap is about putting patients first, not only in discourse, but in real day-to-day caregiving practices. All hands are needed on deck as the ministry steers us towards system transformation, which RNAO applauds. Minister Hosking's vision is bold and transformational. It is what Ontarians need and deserve. But if we are going to shake up the system, we must make sure that it's set up to succeed. And for that, we must reclaim the role of the registered nurse to strengthen our system and build its capacity to meet the needs of Ontarians now and into the future. Thank you.